పాప పుట్టింది శ్రీహరికోటలో 27 సెప్టెంబర్ పుట్టింది. ఆ రోజే 4 అవర్స్కి ప్రాబ్లం స్టార్ట్ అయ్యింది. వెంటనే ఇంకా చాలా టెన్షన్ అనిపించి వాళ్ళు అక్కడ డాక్టర్స్ సజెస్ట్ చేశారు MGM హాస్పిటల్కి. ఇక్కడికి వచ్చిన తర్వాత నెక్స్ట్ డే పాపకి ఎక్కువ ప్రాబ్లం ఉంది, ఎక్కువ రిస్క్ ఉంది అని చెప్పి బ్రెయిన్లో బ్లడ్ క్లాట్ అయిందని చెప్పారు.
நான் இங்கே சென்னை வரும்போது இங்கே NICUவில் அட்மிட் பண்ணிட்டேன். ரிஸ்க் ஜாஸ்தி இருக்குது, வெரி ரேர் கேஸ், சாய்ஸ் கம்மி தான் சொல்லிட்டேன். அப்புறம் நம்மளுக்கு என்ன பண்ண முடியும் தெரியல.
ఆ నెక్స్ట్ డే ఓకే బాగానే ఉంది చూద్దాము అనేసి అన్నారు. ఆ నెక్స్ట్ డే బేబీ హార్ట్ రేట్ పడిపోతుంది, వెంటనే సర్జరీ చేయకపోతే పాప கஷ்டம் అని చెప్పేశారు.
இந்த ரேர் கேஸு, பட் அந்த மாதிரி நம்ம ட்ரை பண்ணிட்டோம், உங்களுக்கு இன்னும் கவலைப்படாத அந்த மாதிரி சொல்லிட்டேன். அவர் ஹரிச்சந்திர சார் வரையும் அந்த நம்மளை பேபி பார்த்துட்டு అப்புறமா அந்த సర్జరీ பண்ணிட்டேன்.
వెంటనే నెక్స్ట్ డే ఆ రోజే సర్జరీ చేశారు. ఓకే పాప అంతా బాగుంది ఇప్పుడు.
I'm Dr Harishchandra, consultant neurosurgeon specializing in Paediatric, Epilepsy and Movement Disorder Surgery. We received a day-old newborn in our neonatal intensive care unit from Shriharikota. This child, following birth, gradually refused to feed and became more drowsy and hence was referred to us. We received the child and we performed an MRI, and in the MRI we saw a huge blood clot compressing on the brainstem and obstructing the normal flow of the fluid in the brain. Vital functions like breathing, the heartbeat and your conscious state are controlled by the brainstem, and when this is being compressed then it affects all these functions, and this is probably the reason the child was drowsy and was referred to us. We had to take this child for surgery. Surgery as such involves 2 steps. In the first step, the baby lies on the back and we divert the obstructed fluid pathway with the help of a drain. And in the same setting, we do the second step where the baby is turned upside down, it lies on its belly, and we make a small opening in the bowl on the back of the head and we evacuate the clot. Surgery as such in these newborn babies is not simple for a variety of reasons. The weight of the baby is hardly around a 20th of an adult, so the drugs needs to be carefully titrated accordingly, and the metabolic system of the babies is still immature, and so again we need to take this into consideration when providing the drugs for these babies. And most important of all, the allowable blood loss for these babies is hardly around probably 50 to 60 or 70 cc. This means that every drop of blood is precious and we need to be very meticulous that we do not lose a lot of blood during this surgery. At the same time, we also have to be conscious that we do not slow down the procedure, because by doing so we may prolong the anesthesia time for these babies. So it needs to be a fine balance between being meticulous and at the same time not slowing down so that the procedure goes as planned. We performed this procedure for roughly around 4 to 5 hours. After the procedure, we are very happy that the child recovered, was able to breathe, feed and move her limbs as any newborn baby would, and we were able to save the life of the child with our timely intervention. It's been a few months since the surgery, and we saw the child recently in the review, and it was a real pleasure to see the smile back on the face of the parents. This child is very special to us because hardly around 100 such newborn presentations have been reported in worldwide literature, and among them she is one among the patients who has undergone a surgery and a very few who has recovered back to her normalcy. This makes this child very special. With the help of our excellent neuro anesthesia team and a strong neuro intensive care unit, we at MGM could perform such difficult complex surgeries. Thank you.
அந்த சர்ஜரியில் நம்ம பேபி இப்போ நம்ம ஹாப்பி மாதிரி இருக்குது. தேங்க்ஸ் டு ஹரிஷ் சார். ஆக்சுவலி அந்த பேபி கண்டிஷன் அந்த டைமில் சார் வெரி வெரி லெஸ் சாய்ஸ். அவர் கம்ஃபர்டபுள் டாக்டர் வித் ஹரிஷ்சந்திர சார். I would like to thanks to Harichandra sir, Neurosurgeon team and Emmanuel sir, and நம்மள பேபி அந்த மாதிரி இருக்குதுன்னா அவரே அந்த காட் மாதிரி இருக்குது.
ఇప్పుడు అందరూ హ్యాపీ. థ్యాంక్ యూ సో మచ్.